Watch out, okay.
So first things first.
Wait, no jokes today?
No jokes today. It's all business.
I don't know how to feel about that.
So first things first, you obviously need your supplies, right? So depending on where you work or what department you're working in, you will need to gather several supplies. For venipuncture, this is very necessary, your tourniquet. Alcohol pads to clean the skin. 4x4s, that's the little square-shaped gauze that we use. They're referred to as 4x4s. Obviously, you'll need an IV needle or your IV kit. Most places do have IV kits, and it comes with everything that you'll need. Tape, tegaderm, alcohol, tourniquet, everything that you need.
What's a tourniquet, ma'am?
That is what you use to tie around the patient's arm.
And which one is that?
The blue band.
The blue band. Tegaderm is a sterile covering that you use to secure the IV once you're done. Saline flush, that's primarily only used if the patient is going to get contrast injection. So after that IV is in, you would want to flush that line with some saline, making sure it's going in the vein and not in the skin. So saline flush is a must before every CT procedure. Gloves, tape to secure the line in place. Some patients may be allergic to the regular tape, so they may need to use the paper tape. And if you need to draw any blood to check for their kidney functions, you would need your tubes. And as always, make sure your supplies are not expired, not open, and that they're all working correctly. So what do you think is the first step you do before you start an IV?
Wash your hands.
Basic step in every
Wash your hands.
Wash your hands, that's right. Wash your hands. So there's different types of needles. They have different sizes. For CT procedures, they primarily like to use at least a 20 gauge minimum, because the needle gauge needs to be kind of big for that contrast injections to flow properly. And the bigger the number, the smaller the gauge. So a 18 gauge needle would be very thick, and a 22 would be smaller in comparison. Okay? So step one, wash your hands. After you wash your hands, you would need to find a good vein to insert your needle. Depends on the procedure, but I think you would only start IVs for CT, MRI, etc. No longer needed in X-ray as much. So for CT procedures, we're going to be injecting contrast, so that vein that you find needs to be a thick, strong one. My favorite place to find a good vein is always the elbow area, because that's where our thick veins are. Some patients, due to chemo or whatever's going on with them, they may have very fragile veins, so you may have to end up using their wrist. I hate going into the wrist. If I have to, I will get a nurse. I'm not doing that. All right, and very important, you can always ask the patient, hey, where do they usually stick you? And they know their body the best, and they'll be able to tell you, oh, they usually get me here, or this arm's better. So always ask your patient. Step two, after you find a good vein, you would apply the tourniquet above the vein to make that vein pop out. Makes it easier for us to see and also insert the needle. And after you tie your tourniquet, you always want to ask the patient, is it too tight, or can I make it a little tighter? And I have a little video here.
Control click, maybe?
No, she has a dual screen.
Oh, okay.
So she sees the video.
does.
Mr. John?
Sorry?
Do you know why there's no audio?
Computer muted.
IT tissue. IT support.
It's Cody.
Is Cody now?
Cody?
IT support? No, no
I
more.
tried last time. I didn't do it. So. None of that rings.
It's not different. It's not bad.
Heater's not unheated, and that's not unheated. I don't know what
Well, we have It always happens. Always.
I can't see it.
So basically you would take the tourniquet and put it under the arm, and you want to stretch that tourniquet so it would become tighter. Is there a video? There you go.
There you go. Yeah, it's okay. It's not taking the speaker for some reason.
Is it a YouTube button?
We already checked.
Yeah, we tried. So you would take the tourniquet and put it underneath the arm, above where you would start your IV, and you want to stretch that tourniquet because our whole goal is to make it as tight as possible. So watch, he's going to stretch, kind of do a crisscross. And then one flap over the other, just like you tie a shoelace, and pull that one under. You don't want to tie it in a bow shape or anything, because after we're done with the IV, you just want to pull it, and it should come out very easily. Okay. And we'll, Jalen and Mr. Donahue, we're gonna go over that in the lab room. How do I get out of here?
And the cursor like disappeared. It's actually crazy. You can see up here, the cursor up here.
Oh, somebody.
No, he's done stuff like
We should let you be.
There you go.
So after your tourniquet is in place, you would take your alcohol pad and start cleaning the vein, starting from the center, and then we would move in circles outside. Starting from the center, move further out, okay? And we're going to allow that area to air dry for about a minute or two. Once that area is clean, you are not supposed to touch it with your hands, with your gloves, because that area is now clean, okay? And I already sent this PowerPoint out to everyone, by the way.
Thank you.
So once your clean area is dry, you are going to remove the cap from the needle. Don't touch the needle with your gloves. It's supposed to be sterile, okay? And these are the different parts of the needle. We have the needle. On top of the needle, we have a thin catheter. We have the hub, and then we have the chamber. So try not to touch the needle, and try not to touch the hub as much as possible. You will see people touch it. It's okay, but try not to do it excessively. And then when you're ready for insertion of the needle, you would kind of hold that skin tight, either up here where above your vein or from underneath.
To make sure that you're on it.
Yes, so that is, some people's veins, they kind of jiggle around, so doing that kind of helps it stabilize the vein. So the needle has a bevel, which is like a pointed diagonal edge. You want to hold the needle bevel up, not bevel down. Where's our bevel? This area. You want to hold the needle bevel up, and you always want to start inserting at an angle. skin, and the vein is not always on the surface of the skin, right? Some people's veins are very deep. So you always want to hold it at an angle of about 20 to 25 degrees. You can see that right there. So you don't want to go straight in, that's a no-no. And you don't want to go in super flat either, because you will just end up going into the very top layer of the skin. And you follow the direction of the vein. If your vein's going in a diagonal way, you would go in the direction of the vein. Yes.
So EpiPens are intramuscular?
Yes. So if you're correctly in the vein, you will immediately see a flash of blood come through into the chamber. If you don't see blood, that means you're not in the vein. So if you see blood return into the chamber, you are able to remove that tourniquet now. Okay. And then you're going to advance that needle just a little bit. You don't want to insert the whole needle into the vein. You're going to blow out that vein. As soon as you see blood, just advance it a very tiny bit. And then at that point, you're no longer needing the needle anymore. You're only going to advance your catheter. So there's a needle, and around the needle there's a thin plastic tubing, catheter, which stays inside the vein. Okay? So you're just going to advance that catheter into the vein at the same time pulling that needle back. There's a video on the PowerPoint. I'm not going to try playing with macros. And if you somehow accidentally remove the whole needle out of the vein before we complete venipuncture, do not use that same needle to go back in, because now that's considered not sterile. Okay? So once your catheter is secured in the vein, you may or may not need to use the 4x4 gauze to clean any blood that may have fell on the skin. And then you would secure your IV by using the tegaderm, that's sterile. And then you can also use tape to secure the tubing on the patient's forearm or arm. And then you dispose your needle in the sharp container, not in a regular trash can. And then you dispose of your gloves and any bloody products in the biohazard trash can.
What's it? Tegaderm?
Tegaderm, that is the sterile sort of drape that holds the IV secure in the patient's skin. That's it. You guys can go into the lab room. Jalen's going to teach you guys proper venipuncture techniques.
So in IR, when they were like doing the drapes and stuff, they would ask for a tegaderm, like you'd open it